Today we are discussing about the different affections of liver in sheep and goats. The liver is the biggest organ in body and it's having the multidimensional functions. It is also called as powerhouse of the body. It is one of the major detoxifying organ, and the activation and deactivation of many substances are takes place in the liver. It is a key organ and key gland for the different metabolic processes. It is highly engaged organ with the complex structures and functions. So though as it is the biggest organ, it has to take much more functional capacity of the metabolism in body. Multidimensional function means it is engaged in various types of metabolism, maybe the fat, protein, carbohydrates. Then it is powerhouse. It generate the energy in the form of glucose, we can say. And finally, it will be considered as a powerhouse of the body, though it is a glucogenesis, gluconeogenesis, or glucogenolysis. So all this takes place from the liver, or the ultimate source of energy will go through the liver only. Major detoxifying organ. So whatever the toxins are there, it get bind to the some type of proteins, and it has been excreted from the body, process detoxification. Then activation, many substances like whatever the medicines we are giving, say for example some dewormers are there, or other structures are there, or other genobiotics. In short terms we can say genobiotics. So some medicines required activations in the liver, then they will come converted into its active form. Then some of the medicines, they will be deactivated from the liver. So likewise, so many functions are there. Then it's a highly engaged organ. So many functions are there. So many functions liver has to do at one time. So that's why it is highly engaged type of organ. Then if you see the structures of liver, it's basically the bile duct, hepatic artery, portal vein. It's major functions of the major structure of the liver. Hepatic parenchyma is made up of the periportal zone, mid zone, and centrilobular zone, or the centrilobular area. Whatever the blood is collected from the intestines will come from the portal vein to the liver, and it will be converted into the different types of the materials, maybe the phospholipids, sphingolipids, glycogen, or etc. So liver parenchyma is made up of 1 lakh to 2 lakhs of the hepatocytes present in the one hepatic plate, forming a parallel array that surrounds the vascular sinusoids. Blood enter in the lobules through peripheral via the hepatic artery and portal veins. It traverses the sinusoidal space, interacting with its cells, and leaves via central vein. Blood flow through the sinusoids is at a right angle to the long axis of the lobule. The functions of liver. Main function of liver is the production and excretion of bile. Then bilirubin metabolism, carbohydrate metabolism, lipid metabolism, xenobiotic metabolism, that is activation and detoxification. Then protein and urea synthesis, and immune function. Basically, immune function is related to the production of the antibodies or globulins. That globulin has been takes place, or the production of globulin has been takes place in the liver only, and that will be transported to the various parts of body wherever it is required. Maybe the surface antibodies, maybe the IgG, IgA, IgM, or like that. So many antibodies that can be produced, or the protein which is required for the globulin can be produced only in the liver. So like that, liver is having the multiple functions: lipid metabolism, carbohydrate metabolism, protein and urea synthesis. Like that, these are the functions of the liver. During the postmortems, we are coming across various types of postmortem alterations in the liver. First, when we do the postmortem, we can see there is a change in color, there is a change in size, there is a change in consistency of the liver. Affected area of liver may be focal or diffuse. Then inflammatory process may be acute hepatitis, chronic hepatitis. Then secondary effects on the liver may be due to the pathology in other organs, like chronic venous congestion. In that case, the pathological condition is present somewhere in the lung or the heart. In that conditions, the chronic venous condition lead to the backflow of the blood, and that lead to the cirrhosis in the liver. So that is also called as a cardiac cirrhosis. Whenever there is alterations, or whenever there is a pathology in the liver, that may lead to the formation of cirrhosis. That is called as the chronic venous congestion, and that is also called as a cardiac cirrhosis. Then tympani, many times due to the ingestion of the high leguminous plants or some chemicals, there are some tympani-like symptoms can be seen in sheep and goat. In that case, there is a pressure over the liver and some of the liver parenchyma is get damaged, and that could be the secondary effect due to the tympani. Then rupture of intestine, sometimes abomasum it get ruptured, and due to that acute peritonitis can be developed because of the leakage of the ingesta or the intestinal content or the abomasal content, that lead to the severe inflammatory reaction, that lead to the changes in the color and the consistency of the liver. So these are the some of the conditions. So changes in color will be the dark color, maybe pale color, maybe reddish, maybe yellowish, maybe greenish. Then size may be atrophy or swollen, and consistency may be soft, fragile or hard. Depending upon the pathological conditions that takes place in the liver, we may get soft liver, maybe get fragile liver, may get hard liver, and the affected areas may be smaller, that will call as a focal, and if it is a bigger area affected, then we'll call as a diffuse type of reaction or diffuse type of pathology in the liver. So like that, the acute inflammation and chronic inflammation. Now we can see the pictorial presentation of the different conditions of the liver. So acute inflammation, also called as acute hepatitis, we can see in case of acute hepatitis, we can see the severe inflammation and the congestion of the liver. Here also you can see acute inflammation. We can see the severe congested areas in the liver parenchyma. Then acute inflammation, one more liver of the same thing. So here you can see the severe inflammatory reaction in the liver. Then focal and suppurative inflammation. So a small abscess can be observed in the liver parenchyma. Here you can see the white area. So it is called as a focal abscess in the liver. So this kind of abscess may be observed because of the so many things. One of the thing is a Corynebacterium is there. So this type of abscess can be seen in the liver parenchyma. It is called as a focal suppurative inflammation, that is focal abscess. Then multifocal abscess. So more than one place we can see 1, 2, 3, 4, 5, 6, 7, 8 abscesses over the surface of the liver or the within the parenchyma of the liver. Then if we cut that abscess, we can see some yellowish type of material, sometimes cheesy type of material, based on the type of etiological agent which are involved in the abscess formation. So this is a abscess, a focal abscess formation or the focal suppurative inflammation of the liver. Then diffuse necrosis, these kind of things can be observed mostly in the sheep and goats. It's because of the clostridial, non-specific clostridial infection can be seen. In that case, the most of the liver parenchyma, it's get affected. As you can see, the multiple patches can be seen over the surface of the liver, and if we cut, we can see the deeper portion of the liver is also affected in the same manner. So diffuse necrosis, ischemic necrosis, it is mostly caused by the clostridial type of infections. Here we can see these are the areas which are showing the ischemic necrosis. Here again, this similar type of lesion, irregular areas present over the surface as well as in the deeper portion of the liver. Here again, the multiple necrotic foci, multiple ischemic necrosis can be seen in the liver parenchyma. Here again, the ischemic necrosis, you can see the areas which is affected. So this is the combination. So the fatty liver is also there. Along with that, the ischemic necrosis is also present over here. So this is also the clostridial type of infection can be seen in the sheep and goats. Again, the diffuse necrosis, ischemic necrosis, again the same clostridial type of infection. The cut section will show this type of reactions. Diffuse necrosis, again the same, the clostridial infection will lead to the these type of lesions. Then the chronic inflammation, we can see the multinodular cirrhosis, or we can see this is the early multinodular cirrhosis. You can see the small white color areas or patches, they are observed, that finally this organ may converted into the small nodules. So here we can see, so variety of this, some nodules are small, means they are in a progress of the pathogenesis. Here there is no complete formation of nodules, but this is the early phase of the multinodular cirrhosis. So here one nodule, 2 nodule, 3 nodules, like that. Multiple nodules can be observed if the animal survives for longer period. But if animal died, we can see this type of early multinodular cirrhosis, that is also called as a cirrhosis or the chronic inflammation of the liver. Again, if we cut the same liver, we can see the irregular areas or the multinodular type of lesions can be observed in the liver parenchyma. Again, the similar type of liver, you can see a little bit small nodules are already formed in the liver parenchyma. You can see the variety of the small nodules. So it is a early multinodular cirrhosis. The chronic inflammation, again, the similar type of lesions, multinodular cirrhosis. Cut section will show similar type of small raised nodular type of reactions in the liver tissues. Fatty liver. So when we came across fatty liver, generally our blade or the scissor will have the small fat droplets over the edges of the scissor or the scalpel blade, so that it will be very easy to identify, and it will be having the greasy or the greasy feel or the oily or fatty feeling to the liver. Again, the fatty liver will have this type of fatty liver, so it having the greasy type of appearance. Similarly, we can see the both, it's quite late stage of fattiness, and it could be the early stage of fattiness. Again, another fatty changes can be observed like this. So edges will not be brown, they will be look pale or a little bit whitish in color. The whole color of the liver will be changed, and the edges will not be come together. If you cut the liver, the edges will not be come to the end to end points, so they will not match to each other. So in that case, liver is tremendously enlarged in case of the fatty changes or the fatty liver. Then chronic inflammation, the fibrinous perihepatitis, mainly it is observed because of the enteric type of bacteria. Mostly the E. coli infection is responsible for this type of chronic type of inflammation, and that is called as a chronic fibrinous perihepatitis. So only the capsular portion and some of the portion of the inner parenchyma is involved in this, but mostly the fibrinous perihepatitis can be observed in case of the enteric type of infections. Here again, we can see the similar type of fibrinous perihepatitis. It's also caused by the enteric bacteria, especially E. coli. Then traumatic type of lesions can be observed in the liver by the so many types of infections, so many type of conditions. So one is the traumatic by the accident, but in sheep and goat, a common cause of traumatic hepatitis is a fasciola hepatica. As we know, we can see picture also as well as the video of the same thing. The traumatic and hemorrhagic type of lesions can be observed in the liver parenchyma by the immature fasciola or the fasciola L3 stage larvae. Here we can see video of the same thing. So the rupture of liver lead to the extensive bleeding in the abdominal cavity, and that lead to the sudden shock to the animal, and animal dies because of the sudden hypovolemia or hypovolemic shock. This type of lesions can be observed, or this type of the postmortem findings can be observed in the L3 stage larva, and that larva will cause the penetrating type of lesions that lead to the perforation to the liver, and after perforation that lead to the extensive bleeding into the abdominal cavity, and animal will die suddenly. So these type of lesions can be observed in the fasciola hepatica. Now here you can see actual larvae, they will look like this. They can migrate through the liver parenchyma, and while migrating through the liver, they will damage to the liver parenchyma. There is a rupture of major blood vessels, hematomas are formed, and ultimately the animal may die because of the sudden loss of blood due to the extensive hemorrhages. Here also you can see the same type of lesions. The extensive blood clots, they are generated, or the extensive blood clot can be present over the surface of liver or near the liver where there is a rupture of the liver parenchyma by the fasciola hepatica. Again, the same thing, we can see the another liver will have the extensive hematomas within the capsule of the liver, and we can see the multiple perforations or the multiple holes or the perforations into the liver parenchyma. Again, the same thing, you can see many fasciola were present over here, and the multiple areas of the perforation, some hemorrhages and blood clots are also present in the same type of liver. Here you can see the big hematomas are present around the liver. Then you can see the perforations here. So multiple type of perforations can be seen in the fasciola hepatica. Again, the fasciola hepatica, the internal hematoma as well as the larvae can be seen into the liver parenchyma. Again, here we can see the multiple perforations by the L3 stage larvae. Here so many small perforations, they are present over the surface of the liver. No doubt within the liver parenchyma or the deeper portion, we can see these type of larvae, they are present in the deeper portion of the liver also. Here also you can see some of the larvae over here. Here again the larva, you can see here, this is the larva. Then besides fasciola hepatica, the other conditions like the parasitic cyst or the hydatid cyst, they sometimes they are present in the liver parenchyma, and many times because of the movements of the liver, movements of the rumen, this this parasitic cyst caused by the cysticercus may be get rupture, and that leaves rounded portion or the rounded areas into the liver parenchyma. So that is nothing but the rupture of the parasitic cyst. Here also we can see there is a rupture of the parasitic cyst that lead to the some abscess or the abscess type of reaction, but it is not actually abscess. It is a ruptured parasitic cyst, and around that the fibrous connective tissue are formed. Then swollen liver, it is observed because of the acute type of any type of acute inflammatory reaction, and there is a swelling. So whenever there is a change in the sodium potassium pump of the all hepatocytes, that lead to the swelling of the liver, accumulation, either accumulation of the water inside the cell, and that lead to the swelling of the liver. Acute type of any toxic material that lead to the swelling of the liver. How to identify swelling of the liver? So just give some cuts to the liver parenchyma and try to match both the ends of the this cut surface. If these ends are matched together, then we can say it is not swollen. But if the cut edges are not matched together, then we can say it is a swollen liver. If they match, this liver is not swollen. If they doesn't match, the liver is swollen. Edges are not matched together because that is the extensive swelling of the liver. Then melanosis, there is a change in color of the liver. So we can see the multiple small black spots can be seen over the surface of the liver. So that is the melanosis, black discoloration of liver. Sometimes it is focal, sometimes the whole liver will be converted into black in color. So melanosis generally observed because of the retention of the retention of blood for a longer period in the liver and low oxygen tension in that particular animal. That these type of lesions can be generally observed because of the hypoxia or the hypoxic conditions, and ultimately the lung is affected in most of the cases that show melanosis or black discoloration of the liver. Here like that, if you cut the section of the liver, we can get the black discoloration of the liver. Then yellow discoloration, many times the liver will look yellow in color. That is observed because of the jaundice. So multiple type of jaundice that can be observed, and multiple etiological agents are also involved in this. So collectively we can say there is a yellow discoloration of liver. That is because of the jaundice. Then cut section will have the throughout section of the liver will have a yellow discoloration. Sometimes there is a affection of liver along with gallbladder, generally will called as a jaundice, and gall sickness together, anaplasmosis in case of the sheep and goat. So in that case, there is an inflammation of the gallbladder, and along with that there is a yellow discoloration. If you see liver is yellow, you can see the adipose tissues are present around the liver or in the peritoneal cavity, in the thoracic cavity also. Wherever there is connective tissues are present, all these connective tissue will be converted into yellow discoloration, or they will be converted into yellow masses. So that is nothing but the jaundice. So along with liver, there is a retention of the bile or the bilirubin or the bile pigment. Simply in the simple language, we can say the bile pigment will be retained into the various parts of the body that lead to the yellowish discoloration of the multiple organs, and that is because of the damage to the liver or the bilirubin metabolism is affected. Then sometimes whenever there is a intrahepatic type of infections are there, means acute type of leptospirosis. In that case, the early stage of acute leptospirosis, we can see this type of liver will have the yellow plus inflammation. The acute hepatitis is there plus yellow discoloration is there. So it's an intrahepatic type of jaundice, we can say. Cut section will have this type of lesions. So yellow plus reddish type of inflammation, or the inflammation plus yellow discoloration together, we can call it is a jaundice or the intrahepatic jaundice, we can say. Then yellow discoloration of the liver, in that case, sometimes there is obstruction to the gallbladder, and that may be lead to the retention of bile. In that case, there is again retention of the bile pigment, and that lead to the changes into the liver also, along with the other organs. Again, this another picture of the same thing, the yellow discoloration of the liver along with fatty changes. So multiple pathogenesis can be seen, yellow discoloration, but along with that fatty changes can be observed. Then yellow discoloration of the liver in case of jaundice. So thylaria, anaplasma, leptospirosis. In that case, we can see this type of liver, the cut section of the same thing. Again, another liver with the cut section, complete yellow discoloration of the liver. Beyond liver, its own pathology, liver is affected by so many other conditions, like while doing the postmortem, so we may came across such type of lesions. So whenever we are getting the rib impressions over the surface of liver, we can say that the animal was suffering from the tympani before death. Animal was suffering from tympani before death, means there is a inflatation or the enlargement of liver before death, that lead to the pressure over the surface of the liver, or the pressure over the liver, and because of that, liver will be pressed over the ribs, and that lead to the pressures of the ribs over the surface of the liver. If you can see carefully, you can see 1 2 3 4 5 6 like that, the ribs impressions can be seen over the surface of the liver. So that is nothing but because of the tympani, there is a pressure of the rumen over the liver, and liver will be pressed against the ribs. So that's why rib impressions can be observed over the surface of the liver. Here again, the same thing, you can see the multiple ribs depressions are present over the here, present over the surface of the liver. Again, the same thing, tympani. Here also the same thing, tympani will show the variety of the patches, or the variety of the edges, ridges, we can say, because of the ribs. The same thing, so it's a combination. So clostridial infection is there, along with that the rib impressions are also there. Another common pathological conditions that can be observed in the liver of the sheep and goat is a chronic venous congestion. Mainly the some pathological condition is present somewhere in the thoracic cavity, but the liver has to pay for it. So whenever there is a backflow of the liver, backflow of the blood, that lead to the retention of the unoxygenated blood or non-oxygenated blood in the liver for a longer period, that lead to the chronic venous congestion. The main etiological factor is present somewhere in the thoracic cavity, maybe in the lung or maybe in the heart. So that lead to the cirrhosis of the liver, and the conditions or the process, it is a chronic venous congestion. So another picture of the chronic venous congestion will have the multiple areas of the dark areas followed by the pale area, or the pale areas followed by the dark area. Here again, same thing, you can see the pale areas, then dark or the congested areas. If you cut the section of the same thing, we will get this type of lesions. So again, same thing, chronic venous congestion. Again, the chronic venous congestion of the similar type, but along with that, we can see the clostridial type of infection, or the infection to the liver. With same thing. Again, the chronic venous congestion. This is a late stage, we can say nutmeg appearance. Whenever there is a long-standing chronic venous congestion can be present in the body, in that case, there is a conversion of the liver into the nutmeg-like appearance. So liver will be look like the nutmeg appearance. In that case, liver will be swollen one, or the maybe contracted one, based on the longevity of the infection. In that case, the most common consistency of the liver is it is fibrotic, or it is little bit harder in consistency, or it will be little bit firm. If we cut this section of that kind of liver, we can see the central portion followed by the pale and red, pale and red, pale and red. So like that, the nutmeg appearance will be observed over here. Again, the similar type of the pathogenesis chronic venous congestion, we can see the lobe of the livers will have the necrosis followed by the congestion. So at the central portion, we can see the pale color surrounded by the reddish color. Same thing has been cut open, so we can see the typical type of the nutmeg appearance that can be observed because of the chronic venous congestion, and mainly its etaology present somewhere into the thoracic cavity. Now, how to assess the liver dysfunction? So mainly we have to find out the bilirubin, which type of bilirubin is there, or which type of bilirubins to differentiate pre-hepatic jaundice, post-hepatic jaundice, or hepatic jaundice. We have to go for the different estimation of the bilirubins. Then total protein, albumin concentration will be less whenever there is a liver damage or the liver dysfunction. Then SGPT will be high, SGOT will be high, alkaline phosphatase will be high, SDH will be high, LDH will be high. So these are the assessment tools for the finding the liver health generally in case of the sheep and goats. Now, jaundice. Three types of jaundice are there, we can say: the hemolytic jaundice, toxic jaundice, obstructive jaundice. Color of tissue will be yellow intense yellow and slightly to moderate yellow in case of the different types of pathological conditions or the different type of jaundice. So color of tissue in case of hemolytic jaundice slightly to moderate yellow. In toxic jaundice it is slightly to moderate yellow, and in obstructive jaundice it is intensely yellow. Then color of plasma, it will be yellow and it is highly yellow in case of the obstructive jaundice. Color of feces will be intense yellow in hemolytic, normal in toxic jaundice, and gray to clay in color. So others like a clay color will be observed in case of the obstructive jaundice, mainly because of the bile is not excreted into the duodenum, that lead to the poor metabolism of the adipose tissue, or the poor metabolism of the fat, that lead to the clay type of, or the greasy oily type of feces. Then consistency of feces is oily or greasy in case of the obstructive jaundice, but in case of hemolytic and toxic jaundice it is normal. Then color of urine is light yellow in the hemolytic, intense yellow in toxic, and intense yellow in obstructive. Ecteric index will be low to moderate in toxic jaundice is moderate, and in case of obstructive jaundice is high. Then Vandenberg reaction will be indirect in hemolytic, biphasic in toxic, and direct into the obstructive type of jaundice. So these are the some of the parameters that we have to differentiate from that. Now remedies to protect the liver: feeding management, so feeder management, then toxin free feeds. So basically we have talked about the toxins and the feeds many times, but in that case the small amount of the toxins, maybe the aflatoxins, the total toxins we can if the animal if the enter into the body of the animal, it will be remain for a longer period, because it will be thrown into the GI tract through the hepatoportal or the bile. We can say, simply we can say, it will go to the intestine, will be absorbed, again come to the liver, again thrown into the intestines through the bile duct, and this cycle is continuously going on unless we give some toxin binders to that particular animal. So the poor quality feed, then the feeder management. So what is feeder management? Basically, whenever the rectangle type of feeders are there, in that case the very small amount of the green feed remain as it is at the corners of the feeder, and that will, in that case there is a formation of fungus, or the generation of fungus can be observed, and that lead to the continuous exposure of the mycotoxins or fungal toxins to the animals. So daily there is a small dose of fungal toxins will enter into the body of the animal, and that lead to the long-standing illness to the liver, and ultimately the cachexia will be there. Animal is not able to put on weight, and that is because of the simply the bad or poor feeder and feed management. Potent hepatocytes regenerative agents like silymarin is to be incorporated frequently into the feed, or the in the regular type of drenching, maybe thrice in a week. Means you can prepare a schedule according to the which type of feeds you are offering to the animals. Then antioxidant to be given, vitamin E, selenium to be given, so that lead to the, it can stop the necrosis of the liver by reducing the free radicals. Then toxin binders, regular toxin binders should be used in case whenever we are using the green powders or long-standing green powders feeding, and maybe the chance of the some toxin binders in that maybe the chance of toxicity, or we can say the chronic aflatoxicosis. In that case it's better to have the toxin binder in feed. Then specific treatment for some of the specific type of infections like bacteria, we can give antibiotics. Then gut acting agents, then say for example clostridial infection is there, so if we are getting liver with ischemic necrosis and the severe inflammation, in that case we can go for the streptopenicillin. If we are suspecting the case for the leptospira, then we can give streptopenicillin plus doxycycline together. Then the protozoa, if the theileria is there, anaplasma is there, in that case we can give either oxytetracycline, buparvacone, or if the babesia is there, in that case we can give the diamagine acesulfate. Then immature fasciola, we can give ivermectin plus chlorsulon. So this type of simple remedies we can follow for the control of the different affections of the liver. So basically the feed management, then the giving of the some silymarin type of agents or the material to the animals, at least to regenerate the livers, then antioxidant regularly, maybe through the mineral mixtures, then toxin binder in feed, and ultimately whenever do the post-mortem of the some dead sheep and goat, if we came across different types of infections, accordingly we can choose the antibiotics. And ultimately, if the we are suspecting the case for protozoa, we can go for oxytetracycline, bupropion, diamazine, and if we are getting fasciola, then we can go for the ivermectin, chlorsulon. So thank you very much.